want to thank everyone for joining us tonight. We are talking about the Uvalde shooting and the impact on our educators and the impact on our kids when they're in the classroom. I just want to start by saying all of us have children or have children in our lives that we love. And the shooting at Robb Elementary was, I think, very impactful for a lot of us. And so I just want to express our thoughts and prayers and ongoing concern for the Uvalde community. Just a couple of housekeeping items for tonight. This is being recorded. After we finish our meeting tonight, this video will be posted to YouTube and then to social media. Please feel free to share it with your colleagues. We had a really informative session last night for parents and caregivers. And we're going to go through some of that material as well today. But I just want to start by saying thank you to our schools and to our educators and to the staff at schools. There are a lot of things I think I could have done in my life, but being an educator isn't one of them. You all are really incredible people and do incredible work, and we really sincerely appreciate your service with children. That being said, just to introduce myself, my name is Beth Keeney. I'm the president and CEO of LifeSpring Health Systems. I'm excited to be with you tonight and to talk with Joe and Mara about the impact of mass shootings on our classrooms. Mara, would you like to give a little introduction?
Sure. I'm Mara Green. I'm the Senior Vice President of the Metro Services here at LifeSpring, and I also oversee several of our child and family services and school-based programs.
Joe?
Hello, my name is Joe Blanford, and I'm the Director of Forensics at LifeSprings.
Thanks, Joe. I want to start with you, just to check in and level set a little bit. Why is it important for us to consider the impact of a mass shooting on the other side of the country here in our area and on our classrooms and in educational environments?
Community tragedies like the shooting in Texas kind of have wide-ranging impacts on all of us, the parents, the children, the educators, and it extends far beyond the events. Secondary trauma and complicated grief, can occur, whether it's directly, people that are directly involved or people that are indirectly involved. And so a lot of the times when people experience traumatic events, they develop, heightened emotional stress, irritability, sadness. And so those kind of things are just, we all feel it in some kind of way, whether we were directly involved or indirectly involved. And a lot of the times, if we're far away from an event, we're still seeing those, those events be repeated over and over. We have 24-hour internet and, news coverage and media, and it's social media. And so a lot of the times, we kind of relive the events of some of the community tragedies like that over and over and over again.
Mara, I think it is part of what is so shocking about the Uvalde situation and tragedy is that this did occur in a place that should be a safe place. This should be somewhere that is safe for students and for faculty and staff. Can you talk a little bit about what happens when our safe places are no longer safe or perceived to be safe?
So we need to be able to step back and think about what it is that makes those safe spaces safe spaces. The adults that we trust, that are around us, the systems that we have in place, We walk from class to class in a single file line, and we hold hands to stay together as a group. We go outside during certain times, and there's always someone there to watch us as we're playing on the playground or our games. We have a scheduled day of events that we are very accustomed to, that give us a sense of comfort and stability and safety. Maintaining those things is very important when something like this happens, because we and the children in our care recognize that we are in a very similar situation if they have had access and know quite a bit about the incident. So we need to maintain those routines and constantly ensure that safety and building of trust.
Joe, can you talk a little bit about what children may be facing when they come back to school in a couple of weeks? Will there be lingering anxiety or concern from students?
There may be, and educators as well, and parents. I think when tragedies happen in a school setting like that, I think it's it's hard on everybody involved, and I think there could be some issues where kids don't want to go to school, or they might. It depends on the age group, but they might have some separation anxiety. The parents might be concerned about whether or not they want to leave their children, or and so I think probably there'll be some maybe some apprehension of children wanting to kind of in it when they go back in the fall.
Thank you. I want to pause here and welcome Dr. Eric Yazel. Dr. Yazel, would you like to introduce yourself?
Yeah, hey, I'm Eric Yazel. I'm the Chief Medical Officer for LifeSpring. Sorry I'm late. Got out of clinic late and traffic was unkind, so thanks for having me here.
Thanks, Dr. Yazel. We are glad that you were able to make it. I'm going to come back to you real quick. Can you talk a little bit about some of the ways that adults will know that children are having a difficult time?
Was that one for me? I'm sorry.
Yeah.
Okay. Yeah. You just have to watch. I mean, any kind of change from the child's, baseline behaviors, but some things are, that you see externally. Some things, some children internalize things. So you may see, kind of acting out behaviors and things like that, some irritability, some sleep disturbances, and then even some more, classic physical symptoms, shortness of breath, or palpitations, nausea and vomiting, abdominal pain are always ones that, that's a standard thing I ask children when I see somebody who's been complaining of abdominal pain is everything going okay? You having any issues at school? Things like that. So those are some other things to watch for that may not be as classic.
And Mara, are those symptoms consistent across all age groups, or do they vary?
They vary, and I can go through a little bit of some developmental stages and what to kind of expect. So common reactions that you will see are similar to what Dr. Yazel said. I'm going to also throw out there a lot of the changes in mood. You might see them be more irritable or angry than usual. You might see them be more sad or withdrawn, anxious, fearful, worried, numb. Numb is one that you might see in as if they're in shock, and that can last quite a while. Changes in behavior that you may see: trouble paying attention or concentrating. It could be more clingy, have trouble separating from caregivers and wanting to stay home. Like you said, somatics stomach aches, headaches, sleeping problems, nightmares. Your elementary school students are going to show more of those sad, withdrawn, scared, anxious feelings. Your middle schoolers up to your high schoolers are going to have more of those, likely to have more of those difficulty paying attention, the somatic responses, sleep problems, that kind of thing, and some of that withdrawal.
And Joe, how will faculty and staff know that they may be experiencing some anxiety or stress related to this event?
Definitely if there's some changes in, in our normal routine, if we kind of stop doing what we do to stay healthy, if we become withdrawn or have sleep difficulty or experience a lot of anxiety and that's abnormal, feeling worn out or overstressed, those kind of things, if they're lingering for periods of time, that might be some telltale signs that maybe something's might need to be worked on.
And when, Joe, does that become a problem? I think all of us felt a lot of concern and anxiety immediately following the event, but when does that become something that requires additional support or help?
Usually, there's no real definite answer on that, but usually if things are remaining and there's difficulty with, kind of getting back into the normal routine, or, if that's lasting for a couple of weeks or, close to a month, I think that's, those are pretty telltale signs that it's lingering around, and there might need to be some support or help. And if it's around that period of time.
So Mara, knowing and understanding that this could be kind of a delayed and ongoing response, what are some things faculty and staff can do in their classroom to best support these children and in their schools?
The most important thing is knowing where the child is and being able to follow the child's lead with what they're expressing and what they need. So you want to step back, understand their need, where they are, and take a moment to help them express their feelings. Because let's face it, we all find that difficult from time to time. And sometimes, especially after events like this, we need to have some support in doing that appropriately. So you need to work with them and respond in age appropriate ways. When you're working with preschoolers and kindergartners, be sure that you're offering very simple information and give them a lot of reassurance that adults are nearby and that are here to support and protect them. Always remain calm when you're talking to them. Make sure that you provide basic facts. You wouldn't want to go into a whole lot of detail with the younger children. In older elementary school age, 6 to 11 years old, you want to listen to how much they know about what's going on, and kind of counterbalance what they may be hearing, and in a calm and reassuring way, talk about the facts and kind kind of dispel any rumors or things that peers might be sharing with them. Again, they may ask questions like, why did this happen? And will this happen here? And we want to help them sort out those feelings and the anxiety that comes along with that. You want to answer briefly, but in a reassuring way, and ensure them that the police and the school system and the adults that are around are taking care of things that need to be taken care of and considered to keep them safe. When you get what we refer to as tweens, the 11 to 13-year-olds, we are pretty sure that they've already heard the news, have been talking about it with their friends at school, and on social media. Again, you want to ask them what they know about it, and it would be reasonable to check in with them so that you can look at the information that they are looking at, so that, again, you can counterbalance anything that's in there. And with teenagers, your high schoolers, you want to give them some space. You want to check in with them. They're more likely to kind of keep to themselves. It's important to give them that space and let them come to you when they're ready to talk, and ask questions, ask them how you might best help them and support them. What do they need to know or to understand better? But listen, I have teens of my own, so listening is the best thing in the top of their list. They will let you know.
Mayor, I had to chuckle a little bit to myself because I'm thinking about my own teenager and how difficult it is to get a meaningful conversation and how sometimes it just comes out of nowhere. So I appreciate those comments. Dr. Yezel, Mara talked about access to information. Can you talk a little bit about what would be appropriate for teachers or educators to share and when do we need to pull it back a little bit?
Yeah, I think, again, finding good, trusted news sources is absolutely vital. And, I know a lot of schools do current events, and I mean, even into the elementary school age. So, I think that's good to understand some things. But you don't want ones that there's a lot of chaos and back and forth and screaming at the TV screen and things like that. And, so I prefer, at least I think our local news do a good job of just kind of giving a blurb of this is what's happening and not a lot of opinion oriented stuff. And I think that's probably, the best way to educate our youth as well. And go from there, and then kind of keep it minimal. Don't just keep rehashing it and things like that. So that's my thoughts. I always say, 10 to 15 minutes and, address it, talk about some of the issues briefly, and then move on from there when it comes to the media side.
Thank you. I want to pause here and remind our attendees that if you would like to drop any comments or questions into the chat or into the Q&A, and we will work through those tonight. To kind of move on and to shift focus a little bit, Joe, I want to come back to you. We've been talking a lot about creating a healthy environment in the schools for children and recognizing when the children may be having a difficult time with what has happened. I want to switch to a little bit of a prevention discussion. What should a teacher or educator do if they are concerned about the potential for violence from a child?
With most of the events that we've seen over the past year, there's been some telltale signs, kind of leading up to the events. That's a lot of the information's kind of after the fact, but there have been warning signs, and I think that's with educators being, the front line. That there's sometimes they're the first people to see, changes in behavior and, students not acting like themselves, or maybe even saying things that are kind of out of character, or, and so those things, should be taken, pretty seriously. And there's, definitely a time where, even just, asking the student directly, what, kind of what's going on. And, I've been watching and just kind of have noticed some changes, and trying to kind of get a read on, if there's something wrong, or if there needs to be some kind of intervention. And so that's definitely something that's, could take place to, as a prevention side of maybe preventing something that could happen.
Mary, would you like to talk a little bit more about that? So like Joe has indicated, recognize it, talk to the kids. What is the next step for the educator?
Sure. So, thanks to some support from our communities, and with the recent Biden administration's focus on child mental health, we have an increasing number of mental health providers in the school systems. We are one of those providers that visits schools in various school districts, and have specific sites in several other school districts, New Albany, Floyd County Schools, or Salem Schools, Jasper Schools, Tell City Schools. If you are experiencing behaviors from a student in the school, then there are more than likely systems put in place already where you, as the teacher, can go to a specific administrator or someone in the counseling office and suggest a possible referral for some mental health assistance or services, some sort of resources that you can help wrap around that child and their family, to assist them with any underlying issues that might be going on. Of course, any of the faculty or staff has the opportunity to do that. Administration, if you do not have a mental health worker in your school, we are open to hearing from the teacher, the administrative staff, anyone, if they need to reach out for assistance and services for a student in any of the schools.
Dr. Yazel, can you talk a little bit about just the overall condition of children and adolescents right now in terms of behavioral health?
Well, it's just it's a tough time. I mean, think of all the issues that are, one in a decade, or, one in a generation that we've dealt with just in the last few years. I mean, I think there's been a lot of understanding lately about the effect of the pandemic and interruptions and, the daily school routines. Some of the social justice issues of last summer, fostered some challenging conversations with our young people, and now school shootings. I mean, these are big, hard, complex issues that, are conversations that a lot of families haven't had for decades, if at all. And, it's just a tough time from a mental health side of things. I mean, we want our kids to not to lose that innocence and allow our kids to be kids, but we can't just put our head in the sand and pretend like some of those issues don't exist, because, that's obviously more negative in the long run. So it's a challenging time. And we've seen an upswing in ER visits for child mental health issues and things. I know we've seen some increased visits, in our own organization. And, I think that's reflective of what's going on out there.
Joe, does COVID make this worse? Does that exacerbate just the overall impact of these sort of events?
during COVID, there was a lot of isolation and people's substance use increased. And also the mental health side of COVID, we're just now seeing. We're seeing, a lot of people, like Dr. Yazel was saying, it was a time where there was a lot of, unemployment and, everybody was kind of all in the house together and the daily routine of life just got upended and it changed for everybody. Schools changed, the school systems changed, the family system and their routines, they all changed. And so that was hard for children and kids and parents alike. And so there's been an increase in, we've been very busy. We're seeing a lot of the kind of the stuff that was happening during COVID. And a lot of mental health issues are kind of coming to light now. And so we're seeing kind of, a lot of numbers of people really coming in to services and trying to get help for stuff when the country was shut down. COVID had an impact on people's mental health in this country.
Mara, you talked quite a bit about just maintaining routine and how important that was in the classroom. Are there other things that teachers or faculty can do to facilitate a healthy and healing environment?
Sure, and I'm going to piggyback a little bit off of what Joe was just saying there on that last question too, if that's okay. We've had an influx of youth in our offices during COVID, and some anxiety and depression issues with some of that isolation, not being able to be around their peers and having that one-on-one together time with them, and that throwing them off their routine with online school, hybrid models of part-time in school, part-time online, that kind of thing have kind of dysregulated, their routines and that kind of thing. So with that being said, helping get back to some of those routines, some of the flow from class to class, and particular care and monitoring during transitions from class to class, and in some of their free time, making sure that they know that an adult, a teacher, someone is nearby if they should need assistance. Ensuring that if there were any kind of concerns, that they're going to follow a procedure that they have put into place, and sharing that information with the students. If you notice that we're routing, sometimes we will route students in this way. I think the other night when we were talking about it, Dr. Yazel talked about dropping his daughter off to swim lessons, and they had a route put in place, and his daughter noticed, so sharing with the students that, hey, we're going to route things this way, and we've got several events going on and we want to keep everybody safe and that kind of thing. It's important to make sure that they understand.
That's great. Mara, before I move on to another question, are there opportunities or options for care for faculty and staff in the area? If they, let's say there's a faculty member or a staff member that says, I've just come through COVID, I brought these kids through COVID. Now I have to worry about the safety in my classroom. I'm feeling very overwhelmed and anxious myself. What are some of the options available to them?
Staff could utilize their EAP. through their school system. And we have available to them 5 free sessions in dealing with the stressors of COVID and or an event such as this. So they are welcome to contact us and utilize those services. Yeah.
And Dr. Yazel, might their family physician also be a place that they talk about some of their concerns?
Oh, absolutely. I mean, unfortunately, this is an issue that, almost every child is going to have some sort of issues processing this. And, our behavioral health system can't accommodate every child. I wish we could, it'd be wonderful. But, we do need, parents, family physicians, just everybody in the community, honestly, to pitch in and help our children process this and feel safe and nurtured and things like that. So, it's one of those everywhere they go needs to be a cognizant of what our children are going through. And certainly family physicians and pediatricians and all those offices play a huge role in that.
And so that would also be the case for the faculty and staff. If they're really having a difficult time, then following up with their family physician may be appropriate.
Oh, absolutely. Absolutely. I think it's not just appropriate, but very, very important.
Okay, thank you. Joe, are there certain things in the school or in the classroom which may be triggering or concerning for students that teachers and staff may want to avoid?
I think, definitely, conversations that are kind of repetitive or, I think, children in the classrooms with their phones, and if things get kind of disrupted, if the normal kind of routine in the classroom is being disrupted, I think that can kind of be triggering for people. If one student's really struggling and it doesn't seem like they're getting any help, that can trigger other students. Sometimes it's what's going on not in the classroom that kind of gets brought into the classroom. And so I think being aware of of everybody, basically, like Mira was saying, and keeping an eye on everybody is, I think, how we kind of give off indicators of maybe something's not correct or right. Definitely if there's any kind of, weapons or gestures or those kind of things, which are normal, a lot of times in that, but probably should be, taken a little bit more seriously now, because just of kind of the times that we live in, I think it's just important to kind of pay attention to the milieu and kind of what's going on with the students.
The truth of the matter is, we're not always going to be sure, because there may be underlying needs with an individual that we're not aware of yet. And, a door slamming could be a trigger for someone. The kid next to them clicking their pen, if they're already anxious and intense, that could be a trigger for them. We need to be mindful of each of the students and allow them, make sure that they know that they can come to the teacher or another faculty member or staff member and let them know that something's bothering them and that they need assistance, so that we can address that as needed.
And Mara, when these things happen, is it appropriate for the classroom to have a discussion? Or should the teacher say, this has happened, here's the basic information, and then move on?
That's a good question. And I think that the teacher will know their students in their classroom best and know whether or not that's would be appropriate or beneficial to the class as a whole. They know who their students are and what their students can deal with, and remain respectful and appropriate in the classroom, and follow along with the teacher's needs. So that would be kind of a case by case, basis.
I'm coming up on the end of the questions that I had for you all tonight, for our panelists tonight. Just a reminder, if you have any questions or anything that we haven't addressed that you would like us to discuss, please drop it into the chat or into the Q&A. Is there anything that I haven't asked that you think is important for our schools to consider moving forward?
I think self-care is pretty important for the educators. The students are gonna thrive when the teachers and the faculty are thriving. And so I think a lot of the times that, sometimes we have to get back on and we have to get back to work, and we kind of have to get the routine started. And a lot of the times, if we can really take care of ourselves, and we can influence and kind of support our the students better if we're taking care of ourselves. And it's kind of always about the basics too. I mean, if we're getting enough rest at night, eating well, keeping up with the things that make us happy, I think we kind of transfer that over to the people that we help.
Definitely encouraging self-care for yourself, the teachers and staff, as well as all of us encouraging self-care to the students that we work with. And always know that that we are here to assist with anything related to these needs, and that we have good collaboration with the faculty and staff in the school systems to meet the needs of both the student and the faculty and staff. We're here to help.
I just think also being cognizant of, I guess, the length of time these things need to be addressed. I think when something like this happens, there's a huge amount of awareness. I mean, that's why we're here tonight. And there's, an outpouring of resources and support. And then that tends to wane over the next, days to weeks and things like that. And then unfortunately, then the next episode pops up, and it's this constant roller coaster. And I think realizing that even, a month, 2 months down the road, just checking in on kids, hey, is everybody okay? Everybody feels safe, is really, really important, because a lot of times their reactions to this far outlast what our acute interventions are.
Okay, all really great points. Joe, did you have any closing words before we wrap up tonight?
Yeah, just once again, just taking care of yourselves, making sure that you're doing it's okay to go through and experience community tragedy, and then start to heal through those processes. And getting back in, it's the summertime, being engaged with your children and your family, taking the well-deserved time that all of you all educators deserve is extremely important. This should be a good time, and a good experience for the summer. You all work hard all year, and so I think getting back into some of the routine and practicing the self-care, so when the students do return, you're on your A game, and there's never really a bad time to ask for help. And so if things are still lingering, and and there's difficulties shaking off some of the things that we talked about tonight, we're available. We're willing to help, no matter who it is. And no matter when it is. So we definitely try to provide services to our educators and school staff, members in the community. So.
Thank you, Joe. I just want to thank our panelists tonight, Joe, Mara, Dr. Yazel. Thank you for your time 2 nights in a row. I really appreciate that each of you took time out of your evening to help our faculty and staff move forward. We are dealing with things that are not normal or okay, and trying to determine how to best support our kids in our schools is really important. So thank you to our attendees. Thank you to our panelists. And hopefully this will be the last time we have to have one of these sorts of discussions. Have a nice evening. Thank you.